This is a patient who develops abdominal pain at home, goes and sees their GP with abdominal pain. GP says you need to see a consultant. They go back home. They make the appointment to see the consultant. Consultant orders an ultrasound. They go back home. They come back to have the ultrasound. They go back home. They come back to see the consultant who tells them he has gallstones. They go back home. They come back to have their preoperative assessment. They go back home. They come back to have the operation. They go back home. They go and see the GP because they have a wound problem. GP says, I haven't received the letter. They go back home. They eventually come to the consultant to be told he's done a great job. Now, no doubt most of you will agree, a very good GP, a very good consultant, but no one is looking at the whole system. No one is seeing the whole care pathway through the patient's eye. And that's why we need different models of delivery. And you probably know, as London's solution to this problem has to have more integrated care, and how do you shift diagnostics more into the community setting. Innovation isn't just about service redesign, it's also about redesigning processes. The surgical checklist, one of the major challenges we have in an operating theatre as it becomes more complex, is safety in that very complex environment. Having 19 different interventions that needs to be checked prior to an incision made in itself, as we've seen recently in the New England Journal of Medicine, with a tremendous impact in reducing the morbidity and mortality of surgery. We're also talking about different business models, and we have many of these innovations there, whether they are innovations in diagnostics and having more blood tests and ultrasound done in the community, innovations in business models through practice-based commissioning, and also more networked and open innovation schemes like the integrated care organizations that we announced in High Quality Care for All. Why are we doing this? Because we believe the future of healthcare delivery will be very different, will be very differentiated models of care delivery, as we have seen in some parts of the country. Innovation is also could be cheaper, and the evidence for that is out there. I haven't used the example of healthcare-acquired infections, but if I could use to you one example of the evidence base, this is a slide I brought from Premier, who are doing some of the work in northwest England, looking at cardiac surgery, and you can clearly see that the procedure cost is cheaper in the innovative hospitals that have actually the best outcomes, the least mortality, if you compare them with the others, which are the more expensive ones, and certainly have a less number of return to the operating theatre. So those who believe that innovation is expensive, I'm sorry to say the evidence base will suggest otherwise. What are the challenges? I think one of the major challenges we have in the NHS is the culture and the leadership that required in driving these inventions into real practice. And you've heard throughout the day many speakers challenging us. How do you take these inventions from the bench side to the bedside, and how do you drive more innovators, more early adopters, and shift that technological or business or process innovation nearer to the patient? And I think there are issues of leadership here, and I thought I'll share with you one slide, one of my favorite slide, and that's Lord Moynihan. Is one of our most famous surgeons. One of the unique things about Moynihan is that he published a book in the 1930s, and I remember even in the 80s, you could not get the fellowship of the Royal College of Surgeons if you don't actually read Moynihan's book. And that's the preface of his book. That's the advice that every surgical trainee received as they went to pass the final fellowship of the Royal College. It isn't just a clinical issue, it is also a managerial issue. And that leadership also needs to be more sympathetic for those risk takers, for those who want to introduce innovation into their practice. And I think that mindset change, I think, is the biggest challenge facing us, and that's why we have the Expo, and that's why I hope with you leaving the Expo you would have captured, you would have learned, you would have shared many of the innovations that we've heard of, and many of the innovations that we've seen in the different strands. We're doing a lot Centrally, when it comes to R&D, I don't think we've ever seen more investment in R&D. Near enough £1 billion is what the National Institute of Health Research is giving out. More than £700 million through the research councils. The approval, we've done a lot in reforming some of the approval of new innovations and new drugs through NICE, but there is more to be done, and we're working with colleagues in the Life Sciences Office in coming up with further proposals for the future. Better commissioning, more intelligent commissioning. How could you commission if you don't have the information and the quality outcome data required to achieve better commissioning, to develop better commissioning skills? Better procurement. Go out there and you will see probably the best procurement for innovation the NHS has ever seen for healthcare acquired infections. The way we've dealt with healthcare acquired infections has been through innovation. Management, and finally incentives, and how do we align these incentives? And many speakers this morning did highlight the importance of aligning the incentives and rewarding those who are taking risk, rewarding those who are changing their practices. High Quality Care for All had a series of policies, what are called priming policies, to make that change happen. Firstly, the Innovation Fund. Although 220 million, I don't want you to leave thinking that is the Innovation Fund. The Innovation Fund is the 100 billion that we spend in the NHS annually. That is what you need to think about. The 220 is to enable you to kickstart that process around making innovation part of everything we do. NHS evidence. If you go to the NICE stand, you will see the NHS evidence, and how do you get that evidence base through a portal to our frontline staff. Probably the site that has had the biggest hit than anything else that the Department of Health has produced in the past. Academic Health Sciences Centres, we have 5 of these, more integrated between universities and the NHS, with very unique governance structures in which we hope that the translational element of research will benefit our patients in the future, and we're about to start the health innovation and education clusters. How do we hold Strategic Health Authority more accountable to innovation by introducing a legal duty? And finally, the challenge prizes. We want to stimulate the best minds in this country, and we have many of them, to come up with the solutions to some of the challenges that I referred to earlier. Major breakthroughs in dementia, major breakthroughs in childhood obesity. To finish off, I thought I should share with you a few thoughts. A politician should never tell anyone what to do, but if you could pardon me, I could tell you what not to do when you're thinking about innovation and where we are as far as the recession is concerned. The advice that is being given to other sectors, non-public sector, private sector, is quite clear. At a time of recession, don't lose your talent. At a time of recession, don't cap back on technology. At a time of recession, do take risk, but take managed risk. At a time of recession, encourage innovations in service developments. Certainly don't retreat to a command and control system. And finally, don't retreat from collaboration. That is the advice that is given to other sectors. I strongly believe that is the advice, and that is the frame of mind we need to adopt as we go through this global recession. The reason for that, because innovation is better for patients, and is quite clear with your attendance today, more than 4,000 people, innovation also stimulates staff. And let's forget what I said this morning, innovation is, and innovation in healthcare, is one very, very important sector as we move and get out of this economic recession, because that is the way we believe the growth in this sector will underpin the growth in our economy in the future. Otherwise, as we celebrate the 200th anniversary of the birth of Charles Darwin, quite clear statement there, it's certainly not the strongest and the most intelligent, it is those who are more susceptible to change. Thank you very much.